Good afternoon, everyone, and welcome to NCCMT, the National Collaborating Center for Methods and Tools, Spotlight on Knowledge Translation Methods and Tools, an overview of the Policy Readiness Tool. My name is Jennifer Yost, and I'm a knowledge broker with the National Collaborating Center for Methods and Tools, and I will be getting us started today and then turning it over to our presenter. We'll just be here on slide 2, just a bit of housekeeping. Please post all of your questions or comments to the Q&A in the bottom right-hand corner of the webinar screen. And you'll want to make sure that you send questions to all, not just privately to the host. We will have a Q&A session at the end of the webinar, but please feel free to go ahead and post your questions as they arise during the webinar. Related to connection issues, we recommend that you use a wired internet connection. There is a WebEx 24-hour helpline that you can use should you have any issues. We'll move on to slide number 3. So we are going to ask you to respond to our polling question, which asks, where are you from? So we're just today trying to get a sense of what province you are from within Canada or if you are outside of Canada. So as we see, I can tell that we have lots of people responding. We have lots of people from Ontario. We have people from British Columbia, Alberta, Saskatchewan, Manitoba, Nova Scotia, and some from outside of Canada. So thank you very much to all of those who are answering. Just give another moment while we try and collect everyone's information. All right. So we're going to head on to our next slide, which we're going to ask you about what sector that you are from in working within public health. So it'll just take us a few seconds here while we move on to our next question. So please let us know what sector you're from. Are you a public health practitioner, a health practitioner in another field, education, research, provincial, territorial government ministry, municipality, a policy analyst, or other? And we can see from the poll here that many people are working within public health, some municipality, policy analysts, working in the ministry, also doing research. So we have some really great answers. Okay, so we're going to move on to our next question. All right, just give us 1 second as we wait for this question to close here, and we'll do a formal welcome to everybody. We're going to move on to slide number 5, and as I mentioned, that we are welcoming everyone here to our Spotlight and Methods and Tools webinar today. So if you just give me a moment, I'm just going to post a message here in the chat. I believe that people are might be having some issues with the audio. So there's now a message there that hopefully will help us with some of you today with the audio issues. Okay, so this is our 18th episode or series in our Spotlight on Methods and Tools webinar series, and we're today going to present an overview of the Policy Readiness Tool. This is a 2-part series, and we'll be giving you information at the end of the webinar about joining us for the 2nd part series. For those of you who may or may not be familiar with the National Collaborating Center of Methods and Tools, we are one of 6 collaborating centers funded by the funded by the Public Health Agency of Canada, while 4 of the other National collaborating centers support the use of research evidence in specific public health content areas. We focus on content areas related to improving the access to and use of methods and tools to support moving research evidence into decisions related to public health practice, programs, and policies. So we are located in Hamilton, Ontario. And as I mentioned, this is our mission. We're dedicated to basically helping people in public health use research evidence in practice. So we'll move on to slide number 9. And at the National Collaborating Center for Methods and Tools, we offer a variety of products and services. In addition to these webinars, we have our Registry of Methods and Tools, in which you will find the features of our webinar series. We also have online learning opportunities within our Learning Center. We also have some multimedia that we've been posting, so some short videos on how to use research evidence in practice. We're going to move on to slide number 10, and it's my pleasure to welcome today Candace Nikiforuk, who is an associate professor in the School of Public Health at the University of Alberta and is also the CHR Public Health Agency of Canada, AIHS Alberta Innovative Health Services Applied Public Health Chair. So it is my pleasure to be turning over the presentation to Candace, and I will be back later on to facilitate our Q&A session.
Okay, thank you, everyone. Thank you so much. I see that we have 87 attendees in place, and I'm really excited to have you all here. I wish we could be talking with each other in a room, because that's always a lot more fun. So I really hope that you'll take advantage of the Q&A session and the polling session to really express your thoughts and tell me what you think, because this tool is really meant to be something that we use in our everyday work, and it gets better with the more feedback we get. So today we're going to be talking about the development of the Policy Readiness Tool, and then also how it can be applied to our work in promoting healthy public policy in all kinds of sectors and settings. I do want to flag for you right now that the follow-up seminar to this one will actually highlight 4 advisors on tap who've actually used the tool in practice, not in research, from all around the country. So I encourage you to sign up again for that seminar, because I think that's where you'll get a lot of hands-on advice from someone who's not me. So we're going to move on from here, and I'd like to start by asking you a poll question. I'd like to know in what ways policy is a part of your work or part of your setting. So if you could take a couple of seconds to click the responses that apply to you. Jennifer, is there any way to display the responses?
I actually am working on that at the moment, and in the meantime, I can tell you that there is actually quite a fair representation of A through F, with the majority of people answering A through C at this point in time.
Awesome. So that means that for the most of us, we're talking about participating in policy advocacy, whether that's formally or informally, helping to find evidence or building case for new policies, or contributing to policy development. So we'll move on to the next question. So my next question for you is, how would you rate your capacity to support or influence the policy process in your community or setting? And I want to be clear that that's any level of the policy process, so don't feel intimidated by the question.
And sorry, it's Jennifer again. While we're still having a bit of difficulty sharing the results with everyone, I will let the group know that most people are answering B or C when it comes to answering this polling question.
So that means that most people are saying that they feel they have medium capacity or low capacity. And I'd like to flag for all of you listening that this is really critical for me to know as we move through the presentation, because I'll tailor some of what I say to better meet where you feel you're at. But I also really strongly encourage you, again, to use the question and answer period to talk about some of the things that you feel might be limiting you or creating barriers for you, and so that I can talk a little bit about how this tool may or may not help address those barriers. So let's move on. So I'd like to introduce you to the Policy Readiness Tool website. This is what the homepage looks like, and you'll notice that it's meant to be very user-friendly. You can see at the top that you can access the tool itself, you can learn more about readiness levels and strategies, as well as access resources. There's also an ability to join what we're calling the PRT community, and what that's meant to be is a group of practitioners, policymakers, students, general public, all being able to talk to one another about their experiences and questions about policy change in the policy process. So I encourage you to check that out and sign up if you're interested. It's free and it's meant to be a lot of fun, and your participation will help make it that way. So let's move into our work of the day, which is really to talk about the Policy Readiness Tool. In general, the Policy Readiness Tool is an evidence-based tool that's intended to help foster the development of healthy public policy. And it's really intended to be very accessible and to make participating in policy change easier for non-experts and experts alike. So when this tool was developed, it was really in response to a need we heard from our advocate and practice partners who said that, there's often a lot of interest or support for taking action in a community or a school or an organization or a province, but a lot of people are intimidated by that process and really, would like guidance on how to get started and how to follow it through. And that's where the development of the Policy Readiness Tool came in. So you'll see on your screen that it's targeted at a wide variety of people and roles, that it's meant to be simple to use. It is absolutely not restricted to health policies, and it is available both in English and French. So we all know that the policy process is dynamic, and this can be intimidating even for those of us who've been swimming those waters for quite some time, especially if you're dealing with new players or new issues or a new setting. Again, the tool is really meant to offer a place to start, particularly if you're not sure how to begin, or if you're encountering a change in your setting or environment that has altered how you may be doing your work. It helps the user to identify the community or organization's relative readiness for a policy, and then based on that relative readiness, it links that to evidence-based strategies that are known to work with different levels of readiness. And then it goes on to provide targeted strategies to help the user work in the policy process in the way most appropriate for them. So we'll move on to the next slide. So in essence, the Policy Readiness Tool itself is a very simple self-administered questionnaire tool. It uses a checklist kind of questioning. It asks 11 questions that the responses to help provide the target evidence-based policy change strategies for taking action based on level of readiness, and then links those to the resources as I mentioned earlier. Now, before we go into talking a little bit about healthy public policy and why the tool is meant to work, I want to reinforce the notion that readiness is really the relative tolerance for risk for taking on a new policy or a new idea. It's not something that's static. So an organization or community that's really ready for one particular issue or one kind of policy may or may not have the same level of readiness for a completely different issue. So it's important to recognize that if you've done this once with your community or organization under a particular topic, you may feel the need to go through it again if you're changing issues or topics, just to revisit how the organization you're dealing with may or may not be ready to tackle the issue at hand. We'll move on. So we're just going to take a step back for those newest to the area and talk about why healthy public policy is important. So in its fundamental definition, healthy public policy is any policy that's intended to improve the overall health of the community, and it seeks to increase individual and community control over the determinants of health. This is a key strategy in the Ottawa Charter for Health Promotion, which tells us that the clearest evidence for effective health intervention is always linked to policy. So policies could be something that's very directly linked to health, but it could also be policies that are linked to transportation or environment or other sectors that impact the health of individuals and communities. So ultimately, to build healthier communities, we want to know that local organizations, skilled and lay advocates, and others who are interested need to be involved in that process of policy change. They all may play different roles and be involved at different levels of the process, but it's critical that they're able to access the process. So in order to support this, we as a community interested in healthy public policy need to really be aware of and address barriers to local participation in public policy and also increase local capacity for policy change. And that's why something like the Policy Readiness Tool is really focused on being accessible to all kinds of users. So when we're thinking about policy change and policy development, the evidence from both political science literature, public health literature, and other literatures is that municipalities and organizations learn policy responses from the experiences of those similar to them. And that could be similar in purpose, similar in size, similar in target audience, but usually that learning comes from connection. And despite our practice-based knowledge on how municipalities or organizations learn from one another, we still are learning more and more about best practices to support the diffusion of policy. And we're going to talk a little bit more about diffusion in a couple of slides, so just bear with me for a moment. And we also know that practitioners value tools and best practices that help them influence the policy process in their own setting. So things really need to be applicable to where you are now, not some foreign context. So I keep going to click my mouse in the wrong place, and that's delaying us. But development of the tool. So the tool actually emerged out of a fuller research program on municipal policy development and diffusion in tobacco control. And just to give you a glimpse of what that actually means is this work began with a National Cancer Institute of Canada grant back in the early 2000s, focused on understanding what led to the adoption and success of municipal tobacco bylaws, so smoke-free spaces predominantly, which led to another CIHR-funded study on understanding how those kinds of bylaws and policies diffused across 2 provinces. That work was also linked to, if you look on the left-hand side of the slide, a variety of tobacco control projects that followed, and then more recently, broader work in the areas of chronic disease prevention and supporting healthy public policy. We'll move on. From a theoretical standpoint, the tool employs Rogers' diffusion of innovations theory to help us understand how participating in policy change can be made more accessible. So it's evidence-based and theoretically sound. And earlier I mentioned that we were going to talk a little bit more about diffusion of innovations and what Rogers had to say about that. So for those of you unfamiliar with this idea, diffusions of innovations is a theory that's used to examine how something new spreads from place to place and over time. So when we take apart the construct, diffusion is really that spread, that idea of things moving across time and place, and the innovation doesn't have to be tangible, but it is something new that is meant to solve a problem or improve a situation. So in our case, the innovation would be a new policy. The third important part to consider about the development of the tool is this idea of level of innovation, which is the degree to which an adopter of a new idea or a new policy is relatively earlier or later in taking up new ideas than other members of the same system. So it's just this idea of putting the time and the when on a continuum and understanding who came first and why, and who came later and why. And the reasons, the whys, can really change from issue to issue. So when we think about understanding level of innovation, I'm going to use the past work on smoke-free spaces bylaws to really illustrate our discussion here. That work revealed that there was common patterns of municipal policy behavior. So despite being in fundamentally different provinces with different kinds of climates, policies really spread in similar ways. And some of the key findings led us to understand that initial adopters were often the first not only to adopt the first time or the first instance of a policy, which may have even taken the form of a council resolution rather than a formal bylaw. They were also the first to then amend those policies or strengthen those bylaws over time as more evaluative evidence came out. So what we know then is that these initiators or innovators reprised their roles as the issue evolved. It wasn't a static point in time. We also found that municipal decision makers followed familiar patterns of policymaking within their own networks. And this was examined over a 50-year period, so we could really know this confidently despite changes in personalities and personnel in the municipalities. We also know that different types of adopter characteristics, so whether they were innovators or later adopters, were suggestive of municipalities' bylaw readiness relative to others in the same policy context. So very briefly, I want to talk a little bit about the stages in developing the tool so that you understand when I say that it's evidence-based, why I say that rather than just trusting me on it. So development of the tool began in 2011. The first phase was to use the literature to pull together a pilot tool, which was then tested with municipal representatives across Alberta. So we used 24 different communities, and these were stratified by size and location across the province. We also did a systematic lit review and an environmental scan and had interviews with key informants who were experts working in some way in the policy arena. So we had bureaucrats, we had advocates, and we actually had decision makers all talking to us about policy development. This helped us to develop the best practice strategies around developing and implementing healthy public policy. So at the time that the tool was developed, our key partners really came from the Provincial Advisory Group of the Alberta Policy Coalition for Chronic Disease Prevention. And one of the advisors on tap in our follow-up seminar is the current policy analyst for that coalition, so you'll be very excited to hear from her. And that coalition includes policy developers and advocates, practitioners, community organizations, and researchers representing 15 different organizations across Alberta who all have a common interest in chronic disease prevention. And you'll see a link on your screen if you want more information about the coalition and their work. So moving past development and to talking about what the Policy Readiness Tool actually is, as I said earlier, it's a simple, self-administered tool that assesses readiness for policy change using easy-to-use checklist. And this is what the checklist or questionnaire looks like on your screen. So you'll see that there's a disclaimer at the top. Then it goes into a series of 11 questions that just ask you to designate A, B, or C using the descriptor that best fits the organization, municipality, or setting that you're working with. After you've done this, it usually takes respondents about 3 to 5 minutes to complete the little checklist. The checklist calculates a readiness categories, and this eases the applicability of assigning a designation of innovator, majority, or late adopters. Those of you who are familiar with Roger's diffusion theory will know that he actually talks about there being 5 categories, but we've simplified that into 3 categories to ease the application of the strategies. And this enables users to apply the tool in a variety of contexts. And I just want to remind you that readiness, again, can be changed from issue to issue or over time, but it's really important to revisit this, and that's easy to do. So just a couple of other caveats is that when you're talking about readiness and whether somebody or an organization is an innovator or a later adopter, this is not a value judgment about that community or organization. There's no such thing as a good or bad adopter category. There's not extra points for being an innovator, and there's not extra points for being later in the process. It just is talking about relative tolerance for risk and relative timing of adoption. So in some cases, an innovator, they might be the first out of the gate, and it might be very positive in that they're setting the stage and providing leadership on the issue. The risk to being an innovator is that at the same time, you're often doing that in the absence of evidence. And so you are taking a big risk moving forward on a policy idea that may have no evaluation or that very little is known about. So you can see what I mean about, it's not inherently good or inherently bad. There's positives and negatives associated with each of the categories, and that's an important thing to keep in mind. So that, in that light, the tool offers an efficient way to select appropriate strategies to support policy development relative to a particular context, recognizing there is not a one-size-fits-all solution. So we talked about how it's a simple self-administered checklist. I also want to point out that the tool provides targeted, evidence-based policy change strategies for taking action based on that level of readiness. And there's a big yellow arrow there to remind me to tell you that we are coming back to that to talk a little bit more about those strategies after you have some practice using the tool. So here's a sample of what those strategies for change actually, what I want to mention is this is a sample of the strategies for change, but this is just the general strategies that can be used irrespective of level of readiness and in a variety of contexts. And this is something that you can access independently of completing the tool, and it just talks about generally how we can support development of healthy public policy. So third, I just want to highlight to you that the tool also provides and recommends general evidence-based resources that help to foster healthy public policy, and the resource pages look like this, and you can select resources to search from a variety of categories to help you find additional tools or samples that can help you with your work. So who can use the tool? Anyone. Anyone interested in encouraging healthy public policy can use the tool, and for now it's available in English and French, and we know that both versions have been downloaded around the world, so that's pretty exciting for us. And it's been downloaded almost 1,500 times since 2014, so that's pretty exciting for all of us because that's the community that we hope is going to really begin contributing to the online group. What kinds of policies can the tool be used with? Well, it's designed to encourage and support everything from smoke-free spaces regulations to policies in injury prevention, nutrition, social planning, location of green spaces, and I put lots of et ceteras there because there are lots of et ceteras, and you'll hear about 4 of those different applications in the next seminar. The tool was originally created with municipalities in mind, but it can be used with other types of governing bodies as well, and that could be individual organizations, schools, school boards, or provinces or territories. So there's a website to the actual checklist online. I'm hoping that you all have your web browsers open and can go check it out while we're talking. But if not, I'm going to, on the next slide, have a sample of a selected of the questions from the questionnaire. We're going to do a little exercise, and what I'd like you to do is to read each line of questions, and with a particular setting or policy issue in mind, choose the closest description, A, B, or C, in each row that describes a characteristic of your setting or policy issue. And then what you'll see is that your result will be provided when you click Finish. If you're completing this online, your result will be provided when you click Finish, and that will link you to particular strategies. But if you're following along on screen, I just want you to note on a piece of paper or something handy to you whether you had mostly A's, mostly B's, or mostly C's, and then everybody, if you can click your response in the poll question of whether you had mostly A's, mostly B's, or mostly C's, we'll have a little talk about what this means. So again, take a moment and think about a community or organization you're familiar with and consider the 5 questions below, or complete the full tool online. The responses won't be perfect, but choose the closest one, and then when you're done, tally your total A, B's, and C's, and submit your responses in the poll. And Jennifer, I'm going to rely on you to let us know when we're done.
Yes, no problem. People are just responding, so we only have about 20% of people having replied so far. But from that, we have mostly A's and mostly B's right now.
Okay. We're just going to take a couple.
I'll keep you updated as we give everyone a few more seconds.
Yeah, I think we'll take a little bit of time because they're kind of hard to read on screen from the presentation.
That sounds good. And just so everyone knows, I've also posted in the chat the direct link to the starting the tool, to the questions as well.
How are we looking, Jennifer?
So we're just almost at about half of the participants having responded, and the majority now are saying mostly B's.
Okay, so we'll give it another minute, and I'll check back in again.
Sounds good.
All right, so Jennifer, do you want to let us know where we're at?
Yeah, sounds great. So we've had almost about 70% of the participants reply to these questions so far. And out of that 70%, half have actually answered mostly Bs. Okay. Another 12% have answered mostly A's, and another 6% have said mostly C's.
All right. So I apologize if you're still going through the questionnaire, but we are going to move on to the next slide. But I think we'll be able to get a sense of where everybody's at. So we're just going to move past that poll. The numbers that Jennifer told us actually correspond quite nicely to how the diffusion of innovation curve plays out. So what you see on your screen there is actually a diffusion of innovations curve. And what we know about that curve is that usually about 67% of respondents or adopters fall into a majority category. And that's that big part that you see. And you can tell that on the phone today or on the call today, 70% of you replied falling into that category. And 16% in a diffusion curve fall in that category of innovator, and then the remaining in that late adopter category. And that's not adopters, just people who adopt later on in the process. So what you can take away from this exercise is that even just running through this with 110 people on the call, all of us coming from different settings, different issues in mind, different categories, we still replicated the diffusion curve. And that's what I mean about this tool being evidence-based and theoretically sound. We know that it's valid and reliable against using it in multiple scenarios. So let's talk a little bit about what these categories mean. Mostly A's corresponds with those adopters that can be described as innovators. And at a very, very general level, this gets into more detail in the tool itself, but at a very general level, innovators are those that are described as adventurous, and they often serve as initiators or leaders or role models within their social networks. Not always, but often. Mostly B's are the majority, and these folks are described as deliberate. And the reason they're described that way is because this group of adopters likes to take a little bit more time to let the evidence come in about an innovation or a policy. They consider that evidence and weigh it relative to their setting, and then to make a decision about whether or not to adopt a new policy. So they may not be the first out the gate, but they're often the first to begin doing evaluations and using evaluative evidence. Mostly C's, these are later adopters, and these adopters are described as traditional. They may be skeptical of new ideas without having substantial evidence in hand to support the adoption, or they may be eager to maintain the status quo in their setting or organizations for a whole host of reasons. These later adopters are often the ones that provide the impetus for the strongest, most reliable evaluations of policies. So they play a very important role in the policy continuum as well. So when we talk about innovators, to unpack that a little bit more at a detailed level, innovators are often attracted by high reward initiatives. They're often risk takers. They typically can cope with elevated levels of uncertainty, so are often well-resourced, and can take risks associated with the adoption of new policies. They are also typically willing to cope with initial problems and work through hiccups with policy development, policy formulation, and try new things. And they are able to identify solutions to those problems, or are willing to at that stage of the game. So just to show you what this looks like on the actual website once you've completed the tool, you'll see here's a sample talking about innovators and the various kinds of strategies that you can use to work with innovators or in an innovator setting. And when you look at the screen, you'll see that there's labels with little plus signs beside them. When you click on a plus sign, it unpacks various strategies under each of those headings. And if you're interested in knowing a little bit more about majority or late adopters in the context of your innovator response, you can click on those boxes as well and learn a little bit more about the other categories. So mostly Bs, the majority, are described as deliberate, as we said. They seldom lead the pack, and they take on the philosophy that it's better to change as a group rather than to be the first one afield. So this is where the thinking around having a critical mass of people willing to adopt a policy all at the same time is really important. And so when you're talking about supporting policy development or doing small a advocacy work around generating support for an issue, this is really what's happening at a majority phase. Majority adopters tend to adopt policies at about the same time as the average adopter. So you'll have some earlier and some later, but they all constitute this large influx of adopters. And so as I showed you with the innovators, here's a little bit of a sample of what the majority page would look like, and you'll see that the headings are very similar to those that are used with innovators, but when you unpack them, what the specific strategies are underneath each heading have been adapted to work with a majority. So when we talk about late adopters, again, these are the traditional adopters. These adopters usually wait until the majority of others have adopted the policy. They also tend to wait until substantive evaluative evidence has been in. They may need to be pressured into policy adoption or worked with quite closely to show how that policy might be a good fit for their setting or best work in their setting. And it's important to note that late adopters may never adopt a policy unless required to. So an example of this from practice is in the context of smoke-free spaces bylaws. A lot of municipalities waited until the province issued a policy and then they just adhered to the provincial policy rather than adopting the policy at the municipal level. So that's an example of being required to. All right, move on and show you an example of the late adopter page. Again, you'll see very similar headings, but underneath each heading, the content has been tailored to working in a late adopter context. So I just want to remind you that these categories are not meant to be set in stone or definitive once and forever. They're meant to be revisited over time and by issue, and they really are not a value judgment about that community, setting, or organization. Like I said, there's goods and bads to each of the categories, and it's not about saying it's good or bad. It's about figuring out a way that you can work in that setting that's the best fit for that setting so that you're making the most effective use of your human resources and your capital resources to take on a particular policy issue or initiative. So the tool is really meant to help with that decision of which strategies might offer the most bang for your buck, so to speak, around targeting your work in a particular context. So I want to just begin to close by talking about some of the things that we've learned from practice so far, and that's really that diffusion and policy spread really depends on the interaction between adopter groups over place and time, and that's because, as you all know, we learn from each other. The tool has supported action and advocacy, and this is because that regardless of category that you're in, the important thing is to find sound innovations, or in this case, good policies, and support the people who are working to get those in place. Another key thing is to make innovator activity observable and visible. So if you're familiar with an organization or a setting that's doing a really innovative thing, spread the word. Help people watch what they're doing, because that will accelerate the whole process of policy adoption across the diffusion curve and make that majority adoption happen sooner rather than later. And doing this kind of thing and understanding policy adoption trends is really useful for refining policy strategies over time. So again, talking about how something can move from being a resolution to a formal bylaw, that happens in stages over time, and so it's really important to understand that how. and it allows you to respond to changes in your policy context, as well as inform new things as they happen in other jurisdictions. So some of the strengths of applying the tool is that it really builds capacity at individual and community levels. It helps to address resource capacity issues of advocates and organizations who take on the responsibility for getting policies off the ground and creating support for issues by targeting their work to strategies that are known to be effective in certain scenarios. And it also helps to build knowledge through intersectoral collaboration. So it encourages those from different sectors to consider new policy change strategies. And the policy community on the Policy Readiness Tool websites is really intended to be that place to share knowledge from different sectors, different contexts, and different settings. We also know that there's limitations to applying this tool. So diffusion theory on paper is happening in one direction, and that's forward. It's time-specific. There's a beginning to a policy context, and then it implies that there's an end by having these later adopters. What we know in real life is that policy spread happens in all kinds of directions. It's not limited in time, and there may never be an end point. So it's difficult to say that there's an end to a particular policy issue. It just evolves. So the late adopter category in our world of policy development and implementation is really one that includes non-adopters, so people who have actively chosen not to adopt, and never adopters, those who will never broach the issue. And so it's important to recognize that when you're thinking about, your work with the tool. Using it is not a guarantee that a policy will happen. We do know that the tool is most applicable to simple, and by that I mean single issue context and straightforward cases of policy change. It can be applied to more strategic envisioning activities like the idea of succession planning in municipalities. It has been done, but it is more complex. And that there's always the caveat that users of the tool must remain flexible and leave room to act on the unexpected, because that's really how policy processes unfold. So on this screen, I'm just going to show you a whole bunch of products that have happened. You'll see these on the website themselves and links to them, and that I just want to emphasize that it's not issue specific, and the tool is not limited to health-related policies. And I also want to mention a little bit about what's happening now. So with the new website that is now interactive, those of you who may have been familiar with the PRT in the past will know that you used to have to download a PDF to complete the tool. Now we found that quite cumbersome for users, so in response to feedback from users, we've created the online completion of the questionnaire component. The resources and strategy sections are always being updated, and we do welcome suggestions from our users as to strategies or resources that should be added or removed from the site. There is an ongoing evaluation of the new website, so that involves an online survey. It's quite brief, and then for those interested, follow-up interviews to talk about their use of the website and the tool itself. So if you're interested in participating in something like that, please go to the Policy Readiness Tool website and participate. We'd love to talk to you more. We're also working to adopt the tool specifically for use in school settings. You'll hear more about that next seminar from one of our practice experts. And then really what we're interested in doing is connecting people from across the country and worldwide who are interested in supporting healthy public policy. So I'm just going to, again, show you the link to the Policy Readiness Tool community. It's really easy to create an account and sign up. And this is to give you unmitigated access to all things that is Policy Readiness Tools. I hope you'll all take advantage and join the conversation or start conversations of your own. And then, as I've mentioned shamelessly throughout this seminar, there is an upcoming webinar on October 1st. It's part 2 of this series. There are 4 advisors on tap, so you won't have to listen to me for another hour. You'll be listening to instead Kayla Atke, who is Policy Analyst for the Alberta Policy Coalition for Chronic Disease Prevention. Kayla will be presenting on her experiences using the tool with the Coalition and how it's been used within a very broad advocacy agenda with multiple initiatives. You'll be hearing from Kathy Glandwin from the Injury Prevention Center here at the University of Alberta, who will be speaking about how they applied to the tool in support of injury prevention initiatives. You'll be hearing from Sherry Jarvis. She's from the Applied Research Collaborations for Health at Dalhousie University. She's going to speak about how they've used the Policy Readiness Tool to select recreation facilities to use as case studies to develop and implement healthy eating policies, so really different application of the tool. And finally, the fourth advisor on tap is going to be Shandy Reed. She was a former policy analyst with the Alberta Policy Coalition for Chronic Disease Prevention and is currently with the Alberta School Employee Benefit Plan. And she's going to be talking specifically about how the tool was used with municipalities here in Alberta, as well as talking about adapting the tool for use with employee wellness in the school setting. So, next slide. In closing, before we switch it over to questions, I'd just like to say thank you to all of the many people who've contributed to the development of the tool. Specifically the Alberta Policy Coalition for Chronic Disease Prevention. They were integrally involved in the development of the original tool and its refinement since. We've also received financial support from a variety of sources over the year, including CIHR, the Alberta Cancer Prevention Legacy Fund, the Killam Trust Fund at the University of Alberta, and CIHR again, just not as training, but as a dissemination grant. So again, I'm shameless plug. Here's the website. Please go check it out. We're pretty proud of it. We've really revamped it, and we're really, really encouraging our users to send us feedback because we want it to be usable. So don't be shy. Send us your compliments and your complaints. And then if you want to talk to me more about Healthy Public Policy, Policy Readiness Tool, or anything that you think might be of mutual interest, please feel free to contact me by email. You can email me directly, or you can email the Policy Readiness Tool email address itself, and you'll get a reply either way. And I want to just close my part with a poll, a final poll. I'd really like to know about your next steps and your plans relative to the Policy Readiness Tool, and please be honest. Feel free to pick whichever applies to you. And yeah, and then we'll go on, after we finish this poll, we'll go on to questions and answers.
Great, thanks so much, Candace. As I am watching people respond to the question, I do apologize with not having the capability to share the results to everyone here on the webinar today. We will try and get that sorted for our next webinar. As Candace mentioned, please go ahead and click actually all that apply. You can select more than one out of all of these steps. So it looks like, as I'm looking, that pretty much across the board, people are saying that they're answering all four. Sorry. So we have about anywhere around 30 to 40% of the group saying that they'll actually access the tool, read the summary, consider using the tool, or tell a colleague. So looks really good. We'll have to check up and see if people actually did that at the next webinar.
No test. Don't be afraid. Come on the webinar.
Okay, so I am going to go ahead and we will actually just remind everyone, we've had some questions be posted in the question and answer session. So please go ahead and continue to post if you have questions. We have mainly a few questions, but mostly related, Candace, to the school setting. And I'm just trying to get this up so I can see it a bit better. If you'll just give me a moment, but it's not quite working. Lovely modern technology. Let's see. Ashira is asking about can this tool be used in a school setting with a variety of stakeholders like student and parent groups? And she was also wondering about when the tool for schools would be available, and can the existing one be used in the meantime?
Okay, so it's a multifaceted question. So if I don't hit all the parts of the answer, just prompt me. So the short answer is yes. Yet the tool can be used most successfully with individual schools or school boards. It gets trickier the farther up the school hierarchy you move and the more bodies, and I don't mean bodies people, I mean bodies schools that are involved. So it can be and has been successfully used in that setting. We're currently, as I hinted, adapting the tool a little bit for use in the school setting because, to be quite transparent, we've bumped into a little bit of pushback around the word policy, because the use of the word policy in a school setting means a very specific thing, and the use of the word policy in the Policy Readiness Tool is actually meant to be quite a general, generic thing. So what we're in the process of doing, and we're actually having a seminar on this in a couple of months, is talking about something called the Idea Readiness Tool, which really retains the same evidence and theory, and it will be as reliable as the Policy Readiness Tool, but is really focused on getting innovations moving in the school setting without being tied to the language of policy. So, Ashira, did I answer all of your question, or is there, Jennifer, I don't know if you can, I can't see very well on my screen, but.
Yeah, no worries. So we'll wait to see. If Ashira answers yes, I can let you know. And she did have a little bit of a more specific question about can the current tool be used in helping applying existing broad policies in the school setting?
Right, okay.
For example, the daily physical activity in school food and beverage policy.
And I would say unequivocally yes. So it's just going through the tool, figuring out which category applies to you, and then using those strategies. Our team actually has experience of using the tool, applying actually those specific policies here in Alberta. So I can say that answer quite confidently.
Great, thanks, Candace. And we'll just give people a few more moments to see if they have any questions. I was just wondering, as a point of just interest, whether you find yourself or would recommend using the tool differently or a different approach depending on who you're using the tool with or in what setting or what type of question that you're trying to answer.
Yeah, I think that's really how it's meant to be used. So I've presented it in its most traditional use, which is go through the survey, figure out where you are, apply the strategies, because that's the very basic fundamental use. But I do also know that we have here used the tool backwards. So we start with the strategies, or we start with what we think is the category and then go back to the strategies and see if they match. Or we use it to identify who innovators or later adopters might be in a particular issue to sort of target our work. So I think the tool itself is meant to be quite flexible and easy to apply, whether you're applying it forward as sort of diagnosing or backwards in terms of investigating or tailoring your work. And the more familiar you get with the tool and its strategies, the easier it is to do that and to adapt it to your own needs. So I know, for example, that the tool is going to be taken up north next week to work with projects in Nunavut, and the person who's taking it is taking the questionnaires but adapting them to a more First Nations respective setting. So it's really meant to be a starting place and one that's easily adaptable to multiple uses. And we've been following its use for a number of years and have had feedback that it is easy to do that.
Great, thanks. And Ashira just commented that she was also wondering about the applicability of the tool being used for readiness for healthy schools, an evidence-based process.
Yes, of course.
All right.
And
yeah, oh, sorry, go ahead, Candace.
So I just do want to speak to that a little bit more clearly, because I'm just looking at her question again and she asked about student and parent groups. And so the way I've been talking about the tool is that an individual sits down and completes the tool and sort of goes away and works, and that's not always the case. The tool can also be completed as a group, as part of a group exercise, where the group talks about each sort of question and collectively picks an answer. And then what that does is it helps the group also. So if you're working with students or parent groups, for example, in Ashira's question, it helps everyone sort of talk out their impressions of the setting or the organization or the municipality and come to, if not consensus, some level of agreement on the nature of the context they're dealing with and how they might move forward for that. So the tool in that context is also really good for team building and conversation setting, and also diagnosing places where there might be real differences of opinion in a team about how to move forward or what's most appropriate for moving forward.
Great, thank you. And actually, Ashira, to your previous comment, had written awesome. So I think you've got it. So Debbie would like to know, is it appropriate to use the Policy Readiness Tool in situations that do not involve something mandated, like legislation? For example, in trying to assess readiness of an organization to adopt a set of guidelines or recommendations, and are you aware of any examples?
So again, the answer is yes. It's absolutely appropriate for that. And so some of the examples where it's not mandated, we'll hear more about next week, but I think the schools, again, to go back to them, is probably the best examples, because it's really about, in the school setting, moving ideas forward. So, for example, in our partnership with the Education Wellness here in Alberta, the tool is really being used to help staff support themselves and each other in initiating employee wellness activities right within a school. So this isn't a guideline, it isn't a policy, it's an activity, it's an idea that may one day inform a guideline or policy, but it's actually just helping that get off the ground and practice strategies for doing so. And so I would say that that example does extend to implementing guidelines, like, for example, food and beverage guidelines in rec facilities. These aren't necessarily things that are mandated, but that the facility can choose to adopt, and using the readiness tool can help support that adoption and implementation all the way up to the more formal policies that you mentioned in the question.
Great, thanks. And Rochelle was just following up on what you mentioned in Nunavut. So was asking, will there be an evaluation of the tool's effectiveness in the areas up north that you mentioned, like Nunavut?
I would say that we would love to do that. What we need to be able to do that is for multiple uses of the tool up north to come forward. So I mentioned the one that I'm familiar with. I'm familiar with it because the person who is intending to use the tool dropped us a line and said, hey, we're intending to use the tool, and you need to change the wording to not be just provinces, you need to say province/territory, which was like, oh, that's quite helpful. So we've made that change and are now partnering with that user to follow her use of the tool and then ideally evaluate it. But in order to do a proper evaluation, we'd need to know about and be invited to participate in other users' experiences. So please let us know.
Great. So I'm just going to move on. We'll see if anyone else has any other questions. Please feel free to post them in the Q&A, and if they pop up, we will stop the forthcoming slides. So I just wanted to also put in a plug, as Candace was saying, for our next webinar. So the next webinar will be on part 2 of the Policy Readiness Tool in Public Health on October 1st and the same time, 1 to 2:30 p.m. Eastern Standard Time. And as Candace has mentioned, we're going to hear stories from public health practitioners about how they've used the tool in practice and their challenges and successes. And I think this is really what is the great thing about these webinar series, is being able to hear from people who work in public health about actually using the tool. So there's a link there to register, but you can also register and find the webinar from NCCMT, our calendar, and I will post a link to that in the chat session. So as I was just talking, Mandy has asked Candace another question for you, and that is, are you aware of any municipalities in Canada that have used the tool to create a policy around community safety and prevention of injury, for example, road safety or helmet use?
So that's it's a simple question, but a complicated answer. I would say I'm not specifically aware of the municipalities, specific municipalities, and that's because we only hear from users who choose to tell us about what they're doing. So I haven't had any municipalities report back that they've used it in that context. They usually just use it and then are happy and don't tell me anything, which is awesome. More awesome if they told me. But I can say, so here's the yes part of the question. Kathy Gladwin, one of the speakers on October 1st, she actually uses the tool quite frequently in the context of those actual issues. So she works with the Injury Prevention Center, and she's going to talk about how they've used the tool in municipalities all across Alberta for promoting things like helmet use, ATV use guidelines, and other kinds of injury prevention initiatives. So she would be a better person to speak to specific municipalities.
Great, thanks, Candace. And we'll go on to the next slide as we wait to see if anyone else has any more questions. And of course, your feedback is always important to us. We'll send an email with a link to this short survey, but myself as well as Candace would appreciate any feedback that you have on our webinar today. And it's just a short survey, should only take you about 5 minutes or so to complete. So while we are just wrapping up here, I'm not seeing any more questions come in, but we can give that another moment. Candace, I was just hoping that you could give, if you had one last thing to say about the Policy Readiness Tool today after your presentation, one last, golden nugget of information to leave the participants with, what might that be?
One nugget. That's hard because I have like 10 nuggets. So I would say the most important thing, whether you decide to check out the Policy Readiness Tool or not, or use it or not, the most important thing is to feel confident moving forward with your ideas in the policy process. I think in general, the policy process gets mystified a little bit, and for some can feel intimidating or inaccessible, and it's really not. I think it's about learning the landscape and figuring out where and when and how are the best ways to get involved, and the tool is meant to help do that. But even if you choose not to use the tool, I think it's important to know that everybody has something to contribute to policy, because it's policy that really creates the settings and environments that we all live, work, and play in. And so it's really important for all of us to work towards creating environments that support all of our health in an equitable fashion. So I know that sounds a bit professory, but I am a professor, so I have to do that. But I do also want to talk about, just put in a little plug for some of the things that Kayla may be touching on October 1st. I'm part of a pan-Canadian coalition called Power Up, and one of our objectives is to link policy evidence around promoting chronic disease prevention and obesity prevention, to link policy evidence with policymakers and advocates to actually use evidence in their work around policy making. So one of the things that happens there is the use of the Policy Readiness Tool to really promote that linking of evidence and action, but also to use the tool to begin to identify policy case studies for those who are working as innovators or majority or late adopters, so that we can collect those stories and share them with others working in the area, so that there's tangible stories and examples that people can refer to from each of the various categories that will always be accessible in terms of seeing how the tool can be applied in each of those contexts. And those, we're in the process of collecting and developing those stories now, and they'll all, as they're finished, begin to appear on the Power Up website. And I don't have the link for you handy, but you just Google Power Up and you'll hit us quite easily. And so if you want